Hi, everyone. Welcome to today's webinar. My name is Zane Davis, Business Strategy Manager for Direct Supply. If you have questions during today's presentation, simply use the Q&A form below to submit them to our team. If you're watching on our landing page, you can scroll down the page to find the question form. If you're watching on YouTube, we've added the link to the question form in the description, so you can find it there. We will answer as many questions as we can throughout and at the end of the presentation, and we intend to spend the bulk of our time on questions, so please don't hesitate to ask any. I want to start by thanking you all for joining on such short notice. OSHA is moving fast on this, so we are too, and we want to do all we can to help you stay informed. Today we will be joined by Littler's Attorney at Law, Brad Hammock, for an OSHA Emergency Temporary Standard update, specifically regarding ventilation in your workplace. OSHA recently released this Emergency Temporary Standard, which we'll probably call the ETS throughout the presentation, to address exposure of COVID-19 to workers in healthcare settings. This webinar will review the ETS, and we will focus on the implications for skilled nursing facilities and assisted living facilities in particular. We'll be discussing the entire ETS at a high level. It includes a lot more than just ventilation, but we're going to spend the bulk of our time on the ventilation section. Brad Hammock's national practice focuses on all aspects of occupational safety and health law. Brad works closely with employers to help them understand and implement safety and health management systems. In addition, he represents employers throughout OSHA rulemaking proceedings, including OSHA's informal public hearings on proposed rules. Brad also defends employers against OSHA enforcement actions. For an employer that is the target of an OSHA inspection, he offers representation from the start of the inspection through settlement or litigation. And now, please welcome Brad Hammock.
Thanks, Zane, and thank you very much to Direct Supply for hosting this webinar, obviously on a very important topic and something that the long-term care industry is focused on intently now. Everyone who's listening to this now knows that most of the requirements of OSHA's Emergency Temporary Standard actually went into effect on Tuesday of this week. They're in effect now, and I'm sure that folks that are listening are doing whatever they can to be in compliance with the Emergency Temporary Standard. I'm really pleased to be able to speak to principally the ventilation requirements of the standard in this presentation. The ventilation requirements, as we'll talk about later on, are not yet in effect. Employers actually have an additional 30 days from the date of publication to get into compliance. So there's a little bit more time with respect to ventilation. But the requirements are important, and I anticipate OSHA will be focused on enforcing those once it starts to get out in the industry to conduct compliance inspections. So it really is a good topic to be focused on, and look forward to presenting here on that. But let's talk about a little bit about the agenda, what we sort of expect to talk about here today. And obviously, as Zane mentioned, really any questions that you have, I look forward to discussing them. So get those queued up and get those in, and happy to address those. We're going to spend a little bit of time talking about the rule itself, sort of aside from the ventilation requirements. First and foremost, who is covered? That is one of the primary questions I'm getting from a number of folks in healthcare and in long-term care. Is this facility covered? Is this type of facility covered? We'll talk about that a little bit to begin with. And then I want to spend just a little bit of time giving you all a high-level overview of what is required by the ETS. Not just ventilation, obviously, as Zane mentioned. It's a comprehensive approach to dealing with COVID-19 in the healthcare industry. So I want to give you an overview of that. And then we're going to dig in a little bit to ventilation, right? What I'm terming the top 5 ventilation expectations that OSHA has with respect to the healthcare industry and the ETS. What do you need to do to get yourselves in compliance from a ventilation standpoint? And some of the things that OSHA expects, and some of the things that you need to be focused on as you try to get into compliance here over the next few weeks. So a lot to cover. As I said, welcome questions, and we'll be sticking around during and then after to answer them as best we can. So with that, let's dive right into it, right? Let's start with the beginning. Who is covered by this rule? And I would say actually before talking this, one of the common questions I get is, why are we here right now? Why is OSHA now focused on healthcare, an ETS, an emergency temporary standard, now that we're 16 months into the pandemic, and we've vaccination rates are up? And I will just say I get that question a lot. There are a lot of factors that are involved here. Some of them are political, some of them are non-political. But nevertheless, it's where we are. And OSHA has determined that right now, an emergency temporary standard is necessary to address COVID-19 risks in certain settings. And what are those settings? Well, essentially healthcare, okay? And OSHA has stated that the ETS is aimed at protecting workers facing the highest COVID-19 hazards, right? Those working in healthcare settings where suspected or confirmed COVID-19 patients are treated. In the rule itself, OSHA defines healthcare services as essentially nurturing or providing some sort of care to patients or residents in a particular establishment or work site. Most directly, for folks that are listening to this in the long-term care industry, OSHA has specifically identified hospitals, nursing homes, and assisted living facilities as industries that are covered by the rule. Okay. Also mentioned are home healthcare workers as well. So there's no doubt that for folks that are listening to this, direct supply customers, OSHA anticipates that as a general matter, you would be performing healthcare services, and thus most of your work sites and most of your employees in your work sites would be covered by the ETS. OSHA specifically identifies as healthcare services hospitals, ambulatory care, home health care, nursing homes, assisted living facilities, or emergency responders, right? So OSHA is taking a very broad approach to healthcare services, right? If you're in the construction industry, you don't have to worry about this. If you're in manufacturing, you don't have to worry about this. But certainly for assisted living, long-term care, skilled nursing, OSHA believes those are healthcare services, and OSHA believes that they are going to be covered by the rule. Okay, so that's the first piece of coverage there. If you're performing a healthcare service, which you are in the long-term care industry. Okay. Who also is covered in this sort of broad approach to healthcare coverage that OSHA has implemented here with the ETS? Well, this is what OSHA is determined is as called healthcare support services. There are a group of services that support the healthcare industry that OSHA believes and has included in coverage of this rule. What does that entail? Well, patient intake admission, patient food service, equipment and facility maintenance, right? Let's underscore that, equipment and facility maintenance, housekeeping services, healthcare laundry services, medical waste handling services, and medical equipment cleaning and reprocessing services, right? What OSHA is basically saying with this coverage provision is, look, there are certain work sites out there that provide healthcare services, SNFs, long-term care, assisted living. In addition, so those folks would be covered. In addition, there are certain employees that support those healthcare services, right? Your maintenance folks, your patient intake folks, all of those folks who support the provision of healthcare services are also covered by the rule. That is the way that OSHA has determined to scope this in, okay? So if you're thinking about this, if you're listening to this now and thinking, am I covered, am I not covered? That is what you need to think about. Do you have folks in your facilities who are performing healthcare services, long-term care, assisted living, and then all your folks who are supporting that day in and day out, your kitchen folks, your maintenance folks, all of those folks are covered as well. So that's an important thing to keep in mind as you're figuring out what your compliance expectations are. Okay. So that starts our basics of coverage. But OSHA says, look, okay, we are going to be presumably thoughtful about this, and we're going to exempt from coverage certain types of healthcare employers and employees in certain categories of folks, right? And so they've carved out some exemptions. And this is typical of the way OSHA does standards. If you're not familiar with OSHA standards generally. They scope folks in a sort of a broad way, and then they exclude folks who they don't think should be covered. Here are the exemptions to the rule that OSHA has carved out. First of all, the provision of first aid by an employee who is not a licensed healthcare provider. Again, not generally relevant to long-term care. This is generally focused on, a manufacturing facility and you have a designated first aid responder. That person is not included. Pharmacists in a retail setting. Okay, pharmacists in a retail setting. This is your classic pharmacy in your CVS or Walgreens or whatever it is. If you are listening to this and you have an internal pharmacy in one of your facilities, this exemption does not apply to you. This is solely focused on pharmacies in a retail setting, okay? Non-hospital ambulatory care settings where non-employees are screened for suspected or confirmed COVID-19, okay? Non-hospital ambulatory care settings where non-employees are screened for suspected or confirmed COVID-19. Some of you who are listening to this may fall into this exemption. If you're providing certain types of behavioral or other types of occupational therapy services in a non-hospital ambulatory care setting, maybe outside of a nursing home or outside of an assisted living facility, you may fit within this exemption, right? This is the typical kind of clinic, physical therapy clinic, occupational therapy clinic that is out there where you screen everyone. It's not in a hospital. You may be exempt if you fall within this particular exemption. So again, if you're listening to this, you may have some facilities that fit within this exemption and you wouldn't be covered accordingly. Hospital ambulatory care settings where employees are fully vaccinated and non-employees are screened prior to entry. Again, this is probably not applicable. This is really focused on hospitals and potential portions of hospitals that have set up ambulatory care settings. Home health care settings where employees are fully vaccinated and non-employees are screened prior to entry. This is directly related and only related to the home health care setting, right? Where you have people going out to individual homes generally, performing services, and everyone is screened prior to entry. Healthcare support services not performed in a healthcare setting. So this would be all your administrative functions. If you operate a SNF, a series of SNFs throughout there, they're going to be covered. But if you've got administrative support services in a different building, they would not be included. And then finally, any telehealth services that you're providing for direct patient care would not be covered as well. Okay, so those are the exemptions there to the overall rule. Again, many would not apply generally to the folks that are listening to this, the direct supply customers, but some may. And if they do, you should look at that carefully to see whether some of your establishments may be exempt from compliance. Okay.
And a question from one of the folks viewing.
Yep.
Would a Catholic convent that does provide healthcare services by paid employees be included in this ETS? They clarify that they're not a licensed or regulated entity since they're a convent and they receive no revenue from Medicare or Medicaid. Okay, so one of the great things about giving these presentations is I always get great questions that I haven't thought about. So let me say a couple things. First of all, whether you receive or do not receive Medicare or Medicaid reimbursements or money or anything like that is irrelevant from an OSHA standpoint. Okay, what the convent is going to have, and the fact that it is a convent also is somewhat irrelevant, right? It's whether at the convent there are healthcare services that are being given, right? This nurturing of residents or patients or individuals in that sort of healthcare setting, that would be what's determinative of whether the scope provision applies. Most likely, I think, again, if the convent is similar to a some sort of assisted living facility or maybe even some sort of skilled nursing facility, OSHA would consider them to be covered. Although it's possible that depending upon the configuration, they may fit within some sort of non-hospital ambulatory care setting exemption. But my guess is if I'm thinking about what this might be, this is another
sort of forum for basically providing healthcare services. And my guess is OSHA would say they are covered generally unless they can fit within an exemption.
Cool. Thank you for that.
Yep. Okay. Great question, though. Keep them coming. As I said, I always learn from these as much as I hope people learn from what I have to say. The last thing I do want to say about exemptions to coverage, this is sort of an all-encompassing exemption that sort of applies everywhere. The ETS does exempt from coverage fully vaccinated workers from masking requirements and distancing and barrier requirements when in well-defined areas where there is no reasonable expectation that any person with suspected or confirmed COVID-19 will be present. What does that mean in practice for a SNF or an assisted living facility or something of that nature? Essentially, if you've got some well-defined areas of your facility and all your folks are vaccinated that will enter that facility, you don't have to require masking or distancing and barrier requirements in those areas. You got a kitchen, you got a break area, those sorts of things. If you limit access, everyone is vaccinated. You don't have to put up physical barriers and masking requirements in those areas. So another thing to keep in mind, I think in a lot of skilled nursing facilities, it's going to be hard to really do this because of the risk of suspected or confirmed cases coming in and out of various areas. But it is an exemption that is applicable, and people should keep that in mind. Okay. All right. So that's the scope. That's obviously one of the most important things. I just want to now go to sort of a high level overall discussion of what the ETS requires, and then dig into the specifics of ventilation. The ETS is comprehensive, as I said. It is, probably one of the most comprehensive standards OSHA's ever come out with. There are certain key requirements for covered employers. All those are set out in the next couple of slides. I want to highlight a few of them. First and foremost, the development of a COVID-19 plan. Many of you who are listening already have that, but OSHA requires that you develop that plan with employee engagement. So you may need to tweak your plans and talk to your workers about that if you haven't already. There's a requirement that you do a hazard assessment, that you screen patients or residents, and you manage that process. There are several requirements related to standard transmission-based requirements. This is something that you all are familiar with, just dealing with CMS and whatnot. I don't think it's going to be a huge burden, but OSHA has integrated them into this rule. Requirements for physical distancing and physical barriers, as well as personal protective equipment. I don't think we need to spend too much time on that, because you all have been living that more than I have over the last 16 months. Additional requirements include cleaning and disinfection, ventilation and maintenance, health screening and medical management, record keeping, and then reporting of COVID-19 fatalities. I want to just highlight a couple of things. Obviously, cleaning and disinfection remains something that's important, at least in OSHA's view, irrespective of the fact that a lot of the CDC guidance and science has suggested that this really isn't a virus that is transmitted readily through surface contact. But those remain in this rule. And then also, we're obviously going to be spending a lot of time on ventilation, so I'll skip over that. But one of the things that OSHA has mandated here is new record-keeping requirements. And in particular, it's requiring that employers keep what's called a COVID-19 log, right? This is a log of all cases of COVID-19, whether or not they're work-related or not, okay? So previously, everyone who's listening to this, you had to keep, obviously, an OSHA 300 log, and you had to put cases of work-related cases of COVID-19 on that log. In addition to that, you now have to keep a separate COVID log where you are tracking all cases of COVID-19 of employees at your work sites, irrespective of how the employee contracted that virus. So another important update to keep in mind as well. So,
Brad, a question on that. Does tracking or documentation begin with the effective date of the rule, or are people required to go back and retroactively document the cases they've already had?
Great question. Everything is going forward from the effective date of the rule. So everyone would have already been keeping an OSHA 300 log of work-related cases. That continues, and that should have been done in the past. But going forward with the COVID log, it's just from the effective date forward. You do not have to retroactively, do that per the OSHA requirements.
And this is specific to COVID right now, not influenza or anything else, correct?
Correct. Just COVID. Yep. Correct. Just COVID. Yep.
And then you mentioned this a little earlier towards the beginning, but some of these rules take effect at different points in time. Could you clarify which of these go into effect when?
Yeah. So about 2.5 weeks ago, the rule was published in the Federal Register. Okay. And then every requirement in the rule became effective as of Tuesday of this week. So what is that? 2 days ago, as of July 6th, except for a few provisions, one of which is ventilation, the second of which is training, and the third is physical barriers. So those three sets of requirements, and I forget the exact paragraph numbers now, those sets of requirements go into effect 30 days from publication. So essentially, rather than 14 days from publication, which was Tuesday, they go into effect 30 days from publication, which is, I don't know the math in front of me, but essentially 2 more weeks for employers to come in compliance with that.
Cool. Thank you.
Yep. Great. So that's a great segue, by the way, Zane, into what will be the remaining focus of the presentation, which is ventilation, right? And as I said, we've got essentially 2 more weeks to get into compliance with the ventilation requirements of this. This is something that we expected OSHA to promulgate. This is, OSHA, in a lot of their health standards, they include various types of ventilation requirements. This is very sort of kind of call it bread and butter safety, right? This is, something that OSHA can kind of, put their teeth into, right? They're like ventilation, air filters, air exchanges, they kind of like that in a lot of their standards. So it's not a surprise that they included that. OSHA concluded, and this is a quote from the preamble of the rule, that improving ventilation is a critical component of an effective multi-layered approach to controlling the spread of COVID-19 and is required for compliance. And so OSHA basically says, look, employers who own or control buildings or structures with an existing heating, ventilation, and air conditioning HVAC system must ensure adequate ventilation in accordance with the paragraphs. Now, there's a note to that, which basically says, in situations where an employer is not in control of the system, employers should, and I put that in italics, coordinate with the building owner or operator to ensure that the HVAC requirements are met. Okay, this is the first little bit of kind of confusion that's out there with respect to the ventilation requirements. Okay, the rule itself says that the obligation to maintain ventilation is for employers who own or control buildings or structures. Okay, so if you've got your own building and you control the HVAC system, you have to be in compliance with these provisions. Similarly, if you lease a space or you own some sort of space and you have control of the HVAC system in that space, then these requirements apply. Presumably, the flip side of that is if you have no control over this, right, then you can't be expected to be in compliance with these provisions. Okay, but then OSHA drops this little should language in here, right, which says in situations where you don't own or control it, you should go ahead and reach out to the building owner and say, hey, what are you going to do to be in compliance with these provisions? I don't know how this is going to shake out in the end with respect to enforcement, whether OSHA is just saying, look, hey, as a best practice employer, if you don't own or control the building, you should go ahead and make a good faith effort to have the building owner control ventilation. I don't know if that's what OSHA's expectation is going to be. But there is a little bit of ambiguity here. What I do know is that if you own a building and if in any way you control the HVAC system, you have to be in compliance with this. It's also, I would say, a best practice and something that you should document. If you don't own the HVAC system it's probably worthwhile reaching out to whoever does own or control the system and saying, hey, there's this rule out here. It's requiring A, B, and C. What can you do to get me get me in compliance with A, B, and C? So that's the best way I can interpret this right now. It's a little confusing. It's a little ambiguous, but that's sort of what we know. Hopefully, OSHA will provide a little bit of guidance later on with respect to buildings where you don't own or control the HVAC system.
Two questions on this front, Brad. Yep. The first, it does specifically say an existing system. So if you have a building, maybe it's only radiator heating, there's no ventilation installed, do you need to add anything in? Are you required to do much for the ventilation requirements?
No, great question, and absolutely not. OSHA makes it clear that this rule in no way requires you to upgrade or put in a new ventilation system. The one thing that OSHA recognizes here is that, and I think this is important, and a credit to them, because if they had mandated something different, the cost of this, which is already at $4 billion for the healthcare industry alone, would have been extraordinary. They are basically saying to employers, work with the system that you currently have. So under no circumstances would they require you to upgrade your system from what you already have.
Cool. Good to hear.
Yeah.
And then related question, any clarity on what they mean by control the system? Does that mean, I go change the setting on the thermostat? Does that mean I have authority to install or replace a rooftop unit? How do they define that? Do you know?
Yeah, they don't define it in the rule. And so we're guessing a little bit, but I think that from OSHA's standpoint, it's more than just, you have the ability to control the thermostat, right? You can turn it down or turn it up. It's that I think what they would anticipate is that you have some degree of the ability or the expectation to maintain the system, right? So change the filters, do the PMs on the system, that type of ability, I think, is what they mean by control. That's my guess. So more than just turning the knob, but maybe not necessarily like owning all the pieces of the piece of equipment. Yeah. Okay. Good.
Cool. Thank you.
Anything else? So two really good questions and important questions. Let's go to the first by segueing into the ventilation top five. What are the key sort of 5 takeaways from a ventilation perspective that we have? Number one, okay, and these are all basic OSHA requirements that are set forth in the standard. So if you're listening to this and you're in charge of maintenance in the ventilation system in one of your facilities, these are the things that you got to keep in mind. First, you have to ensure that the HVAC system is used in accordance with the HVAC manufacturer's instructions and the design specifications of the HVAC system. Okay, this gets to what we were just talking about, Zane, that you don't have to put in a whole new system, but you have to ensure that your system is operating in accordance with the manufacturer's specifications. Okay, OSHA wants your systems to be functioning as designed. Okay, so that really means, looking at your manufacturer's instructions, your design specifications, how does the manufacturer recommend that it be set up and running for your facility? And make sure that your facility is running it in that sense, okay? Now, the other thing that OSHA says is, and this is sort of, again, one of these shoulds that's throughout the requirements, OSHA says that employers may find it useful or necessary to consult with an HVAC professional to comply, okay? I'll pick up on this throughout. You are not required by the rule to go out and get a third-party HVAC specialist to review your system and make sure it's in compliance. Don't have to do it, okay? It's not required by the rule. However, throughout, OSHA says you may need to consult with an HVAC professional to accomplish the requirements that are set out. So this is going to be a facility-by-facility judgment call, really, as to whether you do that or not. If you have the in-house expertise to be able to review your HVAC system, make sure it's running as designed, then great. That's all you need. However, if you don't have that expertise, then you may have to reach out to a third party. OSHA is not going to require it, but OSHA would come in a compliance inspection and say, okay, what have you done to ensure that your HVAC system is operating in accordance with manufacturer's instructions and design specifications? And you have to be able to explain how you've done that, right? The other thing that OSHA notes is, hey, just in general, you should also be monitoring your other types of indoor air quality, your humidity, other sorts of indicators that go to how air is exchanged and sort of the quality of the air in your facilities. That is very vague, very ambiguous. OSHA just kind of throws it out there in the preamble. I suspect based upon what you all are typically doing for CMS reasons, you all are maintaining your systems in a way that keeps humidity down and whatnot. But OSHA says that's something you should be thinking about as well when you're trying to determine whether your HVAC system is working within its design specifications. So that's ventilation number one of the top 5.
So few clarifying points here as well. One of the question was, is there any sort of standard form? My understanding from the preamble is they do mention the ASHRAE standard 180-2018, which kind of is a checklist depending on the different kinds of air handler. Is that required? Is that a suggestion? And then specifically, is the cadence within it recommended? Is OSHA going to be confirming that if a task is required to be done quarterly, that you are doing it quarterly?
Yeah. So two aspects to that. One is it's not a requirement. So there are various references to ASHRAE and a couple of other standards in the preamble to the rule. Those are for that sort of guidance only. If you choose to comply with the cadence or some checklists in an ASHRAE standard, I think you can feel very confident that you are in compliance with the rule, right? So it's one of these things that it could work to your benefit. You could be in compliance, but it's not otherwise required, right? So you can come up with your own checklist, your own form of documentation, your own cadence that you think is appropriate. That's perfectly appropriate. Although, again, if you decide to choose to follow an ASHRAE, then you can feel pretty confident there.
Cool.
I would also note, though, the most important thing in terms of design specifications, in terms of your cadence, and in terms of your PMs and things of that nature, just the best thing to follow is what the manufacturer says. So, look at that manual. Reach out to the manufacturer. If they say quarterly, if they say every 2 weeks, whatever it is, that's the best thing to follow, really, from a compliance standpoint.
Cool. Thank you.
Yep. Okay. So that's number one. Let's go to number 2 in terms of the top 5, right? The second thing you're going to want to do, ensure that the amount of outside air supplied to the HVAC system is maximized to the extent appropriate and compatible with the HVAC system's capabilities, okay? So what OSHA is basically saying here is, however your HVAC system it works. To the extent it's pulling outside air into the building, you're going to want to make sure that is maximized to the extent appropriate and compatible with the system. And this gets a little bit outside of the OSHA lawyer wheelhouse in terms of things like air exchanges and how much air you're pulling in and what's appropriate and what's not appropriate and how that impacts the internal ventilation of the facility. But OSHA wants you to, again, look at your design specs. What is the best way, consistent with your HVAC system operating appropriately, to pull outside air in? Obviously, OSHA would prefer in the COVID environment that you're pulling in outside air as much as possible, as opposed to recirculating inside air, which could have the COVID-19 aerosols in it. So that's the second thing that you're going to want to look at. After obviously making sure your system's running as designed, the second thing is making sure that you're bringing in as much outside air as possible. And obviously, OSHA says you want to maximize the extent of air changes. And here's that little recommendation again. A ventilation expert can assist a building owner in assessing this. You don't have to, but you could seek outside assistance. So that's number 2.
So lots of questions on this one from our audience. Is there any kind of documentation that OSHA specifically requires or recommends in regards to ventilation?
Yeah, so the short answer is no. Okay, and in fact, if you read the rule, you don't have to maintain any documentation for this as a practical matter under the rule. Now, as an OSHA lawyer and as probably folks who deal with regulatory bodies more than I do, that's not a good practice, right? It is important to document that you have done all of these things and what the outcome of these things were. And if you implement an ongoing system of maintenance, right, related to your ventilation system, then you'll want to produce documentation of each time you are proceeding in that fashion. Mm-hmm. So while I can't say OSHA requires it, I can say very strongly to everyone listening, you really, really, really need to do it. Have a system in place, whatever that documentation looks like. And I think there can be a number of different ways to do that. Another number of different platforms available to do that. But certainly having that documentation is critically important, even though it's not absolutely required.
Similar question. Is OSHA requiring that buildings work with something like a test and bounce technician to get readings of their system? Is it more trying to be within manufacturer guidelines? Is either approach fine?
Yeah, mostly manufacturer guidelines for sure. I mean, like as I said, I think answered a couple questions ago, that you're always in pretty good shape if you are following what the manufacturer says. It'll be almost impossible for OSHA to come in and say, hey, you need to do something different when you've got a manual sitting there that says this is what you need to do. However, again, if you have some resources available that are cost effective, then there's certainly nothing wrong with reaching out to those resources and doing some of that testing. It can only help you from a compliance standpoint. Mm-hmm. Some people may not have the resources to do that, which I understand. If you do, though, I would certainly recommend it because it will put you in a stronger compliance position.
So this question kind of combines some of the earlier, what places are required, and then some of the details about ventilation. We have a great audience asking really wonderful questions.
Good.
Does the ventilation in the workplace requirements apply to the whole building, or are there any areas that are considered exempt? For example, will a rehab or therapy gym be required to comply with these standards?
Yeah. So, really good question. So as a technical matter, any place in the work site that is covered by the rule would be covered by these requirements. So a therapy room or a gym would most likely be covered by the rule. I mean, again, we could talk about how maybe there could be some exemption there, but generally, if you consider the provision of therapy, rehabilitative care, occupational therapy as a healthcare service, which I think OSHA generally would, then that would be a covered area because it's covered by the actions taken there. And so the ventilation requirements would apply. Okay. As a technical matter, if you had let's say you had a skilled nursing facility and maybe you had a non-ambulatory care part of that's exempt from the rule, if that's the case, then technically the ventilation requirements would not apply. But that's the way you need to think of it. You need to think of it as a coverage issue as opposed to a ventilation issue.
Okay. Question that I will answer from the audience. So how does OSHA define air exchange requirements for HVAC systems within the ETS? So my understanding, and Brad, please do correct me if I'm wrong here, air exchange is talking about air changes per hour. So how much air you're moving through the space. They're not defining any specific requirement for any specific setting. They're saying you need to maximize the air changes per hour relative to how your system is designed. Is that the correct interpretation?
Yeah, no, that's spot on. Exactly. They're not saying you need to have 100 air exchanges or whatnot. They're saying maximize the air exchanges that your system is designed to do. Yes.
Yep. Perfect. Cool. We can keep moving on.
Yep. Okay, number 3 of the top 5. Gone through the first, the second. Now we're on to number 3. Of course, there's never a ventilation requirement without some stuff related to air filters. So OSHA's got some requirements related to air filters for your systems. OSHA says that you need to ensure that air filters are rated with a minimum efficiency reporting value of 13 or higher if your system allows it. Okay, if your system allows it. If your system does not allow such a filter, then you must use the filter with the highest compatible filtering efficiency for the HVAC system. Okay, so this kind of gets back to what we've been talking about in one of the themes here. You don't have to change your system. You don't have to redesign your system. You have to work your system to its highest efficiency. And with respect to filters, if your system can manage an air filter with a MERV of 13 or higher, you should be using it. Okay, that's what OSHA says. That's the requirement. If your system can't take that, then you need to use whatever the highest efficiency filter is that's compatible with your system. The one thing that OSHA notes in the preamble to the rule, though, that is interesting is you really do need to look at your system specs. And OSHA actually cautions employers, don't use a filter that does it sort of a high efficiency filter that is sort of too high for your system, so to speak, because that can impair the functionality of the HVAC system generally, and that will actually have a detrimental effect on the efficiency and the productivity of the system. And that's not what OSHA's intent is. OSHA's intent is to just maximize it to the design of your system. So, obviously one thing you're going to need to do, look at what your system takes. Again, go back to the design specifications and determine what the most efficient filter is, most protective filter is, and make sure you're using that. And again, document that. And another thing that's important to keep in mind is you're changing out those filters, right? That's another one that we'll be talking about here in a second. But you're putting in these filters, make sure they're switched out as required by the design specifications of the system. Okay, number 4, and actually I got ahead. The 4th was just what I was saying, right? Make sure your filters are maintained and replaced as necessary to ensure the proper function and performance of the HVAC system. Follow the manufacturer's recommendations. Okay, this is at one level obvious, but really important, because I anticipate, and to sort of back up, if you guys are going to be facing an OSHA compliance inspection, for example, there are certain things that an OSHA compliance officer can really dig their teeth into. I kind of alluded to that a few slides back. Ventilation stuff is right in their wheelhouse. You're a OSHA compliance officer. You spend time in manufacturing facilities. You spend time on construction sites. You know all about ventilation, right? And filters and changing filters and maintaining them. So it's critically important that you have a system in place that makes sure that you are being prompted, right, about when a filter needs to be changed, when your system needs to be maintained, and then documents that, right? I know folks listening who are familiar with direct supply know all about this. That's one of the great things about direct supply. They provide tools for this. But that is absolutely critical to keep in mind. And that's really what OSHA is asking you to do. So if you have a system in place that prompts you, maintains that, this is when you need to change the filter. This is when you need to check the system itself. It's critically important to be in compliance. And so that's the big takeaway from number 4 here of the top 5. Just make sure you've got in your system prompts to make sure you're doing these things when they're required to be done.
So similar question to last time, but now for filters instead of ventilation. Is OSHA saying that you need to do MERV 13 every 3 months, or are they saying you need to do what's best for your particular system?
What's best for your particular system? If you're MERV 13, and you can, if your system says I can take MERV 13, right? I love MERV 13, right? Let's bring it on. Then by all means you're required to do that. But you also, you don't have to necessarily replace the filters on any particular cadence. It's not every 3 months, not every 2 months in particular. It's whatever your system suggests that you do, right? So, if you got a system that can't handle MERV 13, you don't need to do it, right? Just follow what your system calls for.
And to give some additional clarity to our audience, we've spoken with some HVAC technicians about this. You can often find this information from the manufacturer. What is the maximum MERV rating you can use? What cadence is best? You can also work with a technician, though, where they can help you understand that, especially if you can't find in the documentation for what you are working with. Our understanding, and Brad, I want to get your thoughts on this. If you have any documentation from a certified HVAC technician or other expert, is that probably going to be sufficient for OSHA as well if you can't get the manufacturer's documentation?
Yeah, 100%. It's a good other compliance option. I know. Look, I'm sure people listening have facilities, that they inherited, 60 years ago, and they've got some HVAC system that they've maintained. But boy, trying to find some manufacturer specs for that is not easy. I get it. So one good compliance approach would be to get in a tech third party, to give recommendations about how the system's designed and what it can take, and to implement that.
Now, we've been talking about filters. Is this specifically for filters in the HVAC system as opposed to, portable filters that you might add to a room?
Yeah, this is specific to filters in your HVAC system, not portable filters or other types of air filtration devices that might be out there. I mean, in fact, in the rule, OSHA actually says, look, employers may and are encouraged to put in other types of air purifying equipment throughout the facility. And so that's encouraged, but this doesn't speak to that issue. Now, if you do, I would say this, though, if you are putting in those types of pieces of equipment, just like everything else, whatever the manufacturer says in terms of filters and design and following that would be recommended. But this is really just related to your HVAC system.
Cool. Thank you. Yeah, and we will, just for everyone watching, we will get into some of these additional air quality products later towards the end of the presentation if we have time. Yeah. Cool. Thanks, Brad.
Yep. Okay. And great questions, everyone. And last, I think, but not least, at least on the top 5, OSHA has some requirements regarding intake ports that are providing outside air to the HVAC system, or sometimes recirculating the air. Just like the filters, OSHA says, again, these don't need to be replaced or don't need any particular type of design, but you need to have a system and a schedule to clean and maintain them from any debris that may affect the performance of the system. Again, here this is it's interesting in the preamble, they say this would include the establishment and implementation of a planned maintenance schedule that identifies the frequency with which the removal of dust and debris from ductwork, et cetera, would occur. Again, going back to what we talked about in number 4, right? Having that system in place, scheduling that system, following that system, and documenting it are key to compliance here. An easy citation for a compliance officer is coming in and saying, "Look, well, this says you have to make sure your intake your intake portals are clear every 3 months, and you haven't done it in 9 months, right?" That's an easy citation here. So, make sure you have that schedule, make sure you follow it, and that'll be really a huge key to compliance. None of this stuff is particularly complicated in my view. Again, I say that as the sort of the OSHA lawyer who's not an HVAC specialist by any means, but it's all very much looking at your own system, doing what your system is designed to do, doing it as scheduled, and then documenting that. Those 4 things are going to be the keys to be in compliance with this rule. So, those are the top 5. I think, if you do those things, you're going to be in good shape. Last slide deals with just effective dates, demonstrating, OSHA has said employers should demonstrate a good faith effort in achieving the requirements here within 30 days. of the effective date of the standard. I just want to emphasize that language, good faith. OSHA has said in a number of instances, hey, these compliance deadlines are strict, are stringent. We get it, 14 days, 30 days. But they have said, look, we will use our discretion. We will use our judgment. If you are in good faith trying to get into compliance, we're not going to go out and start writing citations. So really just sort of start taking, make sure you're making those good faith efforts now, taking steps to be in compliance. And that will really go a long way in terms of avoiding OSHA citations, certainly OSHA inspections as well. Yeah.
So just adding some more clarity around good faith.
Yep.
This is the height of what we call cooling season, where everyone, we just had this huge heat wave out in the Northwest. Everyone is discovering that they're having issues with their system. HVAC technicians are booked out weeks on end. Is it sufficient to have reached out to someone, scheduled some work? What is OSHA looking for? Like, how do they define a good faith effort? Yeah.
So the good and the bad news is there's no strict definition of good faith effort. Mm-hmm. And I get it. You're right. This is the time of year where it's very difficult to have someone come out and check your HVAC unit, whether it's in your own home or if it's in your facility. So I get that. I think that there's a couple things that you should be doing to demonstrate good faith. First of all, go through the effort of, gathering up your manufacturer's design specifications, looking at that, trying to figure out how your system's configured, on your own, right? The things that you can do without a third party, for example, you should go ahead and start doing, right? If you have in-house maintenance, look at your system. What types of filters does it use? Reach out to the manufacturer, those sorts of things. Start that process and document that. And then, if you need to bring in a third party, or if you need to bring in some technical assistance, go ahead and get that scheduled, document that, get it in as soon as possible. And I think if you do all of those things, OSHA will determine that you've exhibited good faith.
Perfect. So gonna switch to questions now. Okay. If you folks have additional questions, please keep them coming via that form. Again, if you're watching on our page, scroll all the way down to the bottom. You'll see the form there. If you're watching on YouTube, in the description, you'll see a link to that form. You can use this URL here that you see at the bottom of the screen as well. So keep the questions coming. I'm going to dive into a few, though, that have already come in.
Correct.
Brad, what plan of action does OSHA provide if they issue a citation or find something at fault?
Well, so a couple things to keep in mind for the long-term care industry. OSHA currently has a national emphasis program, which it implemented a couple of months ago. Probably most folks are familiar with this, which allows OSHA to come into long-term care facilities without sort of prior notice and conduct a COVID-19 inspection. Okay, so this allows OSHA to come in. Long-term care facilities get put on a list. And a compliance officer could show up and say, hey, I've got a COVID-19 national emphasis program inspection that I want to conduct. So that's the first thing. That's how they're going to get into your buildings generally. They could also come in with an employee complaint, but that's generally how they're going to get into your buildings. If they do come in, they're going to conduct an inspection dealing with a number of different things related to the ETS. Look at whether you have a plan, look at whether you've done your ventilation. Again, and if you're in violation or you're not exhibiting good faith, you could get issued a citation and a notification of penalty, depending upon how many violations that OSHA finds. Typically, a violation would be classified as serious and would carry a penalty, of a maximum penalty of about $13,000 per violation. So, you can kind of figure it out, do the math. If you get 4 or 5 violations, then you're looking at, $40,000 or $50,000. But if you're exhibiting good faith, I think OSHA may just come in and say, look, this is great what you're doing. You need to, keep working at it. We're going to give you a notice that you've still got some work to do, but we're not going to fine you. So that's really kind of where you want to be, at least in the near term.
Perfect. Thanks. I'm going to answer just a few quick questions that we had come in. Will TELS be implementing a TELS task or best practices for the OSHA ETS? Yes, we are. We're actually going to walk through some of that in a minute here. Will direct supply support this documentation via TELS, yes, exactly. That's what we're hoping to do for you all, and we're working on it now, and we'll discuss that in a minute. Can I receive a copy of today's presentation? 100%. We'll make it available to everyone, both a recording of the presentation as well as the document itself. We'll have that available for you all to download and share. Other questions for you, Brad. What has changed, in your opinion, from OSHA's standpoint on COVID that's driving these new emergency temporary standards?
Yeah, it's really I hate to say it, it's very there are a lot of, and I'm going to use this word, politics involved. It's kind of a small p politics. There's a lot of various groups that are interested in safety and health that from all sides that have been pushing OSHA to do an emergency temporary standard for a number of months. Under the last administration, they made the decision that they did not think one was necessary or needed. President Biden, when he came in, issued an executive order which required OSHA to reassess that position. And ultimately, I think part of this was a change in administration that determined that this rule was now necessary when the last administration determined that it wasn't. There's just a lot of kind of things like that in play that I think have brought us here. But nevertheless, we are here, and at least for healthcare employers, they need to take note.
And with emergency temporary standards, they tend to become a non-emergency, the actual standard eventually.
Yeah. So the way emergency temporary standard works, and they're very rare. Rarely has OSHA implemented these in the past. They issue the standard, and it goes into effect immediately. And then that standard also serves as a proposed rule. And OSHA seeks comment on it, right? So right now, OSHA has actually established a docket to receive public comment up through July 21st on the rule itself. And then OSHA has 6 months to either finalize the rule, make changes to it and make it final, or to rescind it. And so that's where we are right now. The requirements are in effect, but OSHA has 6 months to determine, what it's going to do with it going forward.
Perfect. So getting into some particulars, if everyone in the nursing home is vaccinated or COVID negative, does this mean that no masks are required?
That's a very good and a little bit of a tricky question. So if everyone is vaccinated, right, all employees are vaccinated, and there is no risk of transmission from residents or patients, right? There's no suspected or confirmed COVID-19 cases. There is that exemption to the rule, which basically says vaccinated workers do not have to wear masks. So the reason I sound a little bit more hesitant is because I don't think actually OSHA's intent was that for an entire nursing home that folks go without masks. But I think you can read that exemption that way. And so, I think the answer is yes, provided everyone is vaccinated and there's no risk of, suspected or confirmed COVID-19 transmission.
Now, I know we're discussing OSHA here primarily. Are there other, governing authorities that might still have mask mandates?
Yeah, I'm glad you mentioned that. I should have said that. Yeah, that's just OSHA. I mean, so there could be state, local requirements still with respect to masking, and folks listening might know maybe CMS still has some masking requirements. I'm not familiar with those, so that's just from OSHA. And one of the things that OSHA says here, which is interesting because sometimes they don't do this, is that they do not intend for this rule to restrict other types of state and local and other federal mandates that are going to be out there on COVID-19. So you need to watch that as well.
Interesting. Thanks. Another non-ventilation related question. Related to the OSHA 300 form, how are we to determine if an employee contracted COVID in the workplace versus in the community? Does OSHA give any guidance on that front?
Yeah, so OSHA doesn't give any guidance on that really in the rule itself. OSHA has provided guidance over the course of the last several months on that. the answer, how are we to determine? It's very hard. OSHA says that essentially when you have a case that you need to review, perform contact tracing, review the job activities of the employee, review whether they may have had any workplace exposures, and then dig into whether they may have had any non-work related exposures that you're familiar with, any community-based exposures. And then you gather all that information and then you make a judgment as to whether it's work related or not. I will tell you it's very difficult to do. It's almost impossible to determine conclusively whether a case was work related or not. Many times when there's outbreaks or something in a skilled nursing facility or assisted living facility, there's also a community outbreak. And so very, very difficult. The other thing that I would note is that folks listening probably know this. A lot of folks who work in one skilled nursing facility are going to also work in another skilled nursing facility across the street. So it's really, really tough to determine.
Mm-hmm. Thanks. Question maybe we can work on together. Kind of similar to the question about air purifiers earlier, as opposed to filters in the HVAC system. PTACs have filters as well. Does OSHA give any clarity on any requirements either for PTACs in general or for filters and PTACs in particular? PTACs, if you're not familiar, are
so tell me PTACs.
Yeah. So PTACs are what you're used to seeing in a like a hotel room. So it's called I believe a package terminal air conditioning unit. Yeah. It mounts into a wall. It's what you're used to in a hotel. They're very common in senior living.
Yeah. Got it. Okay. I see. Yeah. So it's really interesting. Well, first of all, and welcome your feedback on this. OSHA doesn't speak about this, right? This is not specifically called out or identified by OSHA in any way. I think that OSHA would view a PTAC, as I'm understanding it or envisioning it, as part of the HVAC system.
Yep. Because
it is circulating air within, the areas of the facility that would perform healthcare services. So I think that they probably would say that it applies there. I don't know if that would be your read as well. That's just based on my sense.
Yeah, and I'm very grateful for this question. Part of why we hold these webinars is we want to drive the conversation, and this gives us opportunities to find questions that we can then go answer on behalf of our customers. Yeah. So we'll work on getting clarity on this too. My understanding of it would be similar to yours. It probably is considered part of the HVAC system. PTACs very rarely have filters, like they usually don't even have MERV ratings. They're really just for dust. They're reusable and cleanable. My understanding of the OSHA guidance, again, use the highest level of filtration that's appropriate for that system. In a PTAC, that's going to probably be what's in it already to begin with. You're not going to, there's no such thing as upgrading to MERV 13. What I would say though, depending on the PTAC you have, you can influence the amount of outside air it's taking in. And again, work with the manufacturer guidelines, specifications. You can maximize the amount of ventilation, the air changes per hour, relative to how it's designed. So it might fall in the ventilation bucket. I would be very surprised if it falls into the filtration bucket, but that's something that we can try to get clarity on, and we'll keep everyone updated as much as we can.
Yeah, good.
Getting back into where this does or doesn't apply, since some maintenance is performed by third parties in senior living, does this standard apply to those businesses such as electrician, plumbers, or is it only relevant to like the setting where the healthcare is being provided?
So the rule applies to healthcare support services in settings where healthcare services are supplied. So, if you are performing healthcare support services in an administrative complex that is otherwise providing healthcare services, billing and whatnot, then as a technical matter, it's not applicable. But if you are performing healthcare support services in an area where healthcare services are supplied, whether it's electrician or something like that, then those people are covered by the standard, and those activities are covered by the standard. Now, some activities are some requirements aren't going to be applicable. I mean, for example, let's say you're an outside electrician that comes into hospitals, right? The ventilation requirements aren't going to be applicable to you, right? But certain of the benefit provisions and certain of the, masking provisions and whatnot may be applicable. So
Okay.
I think that's the way that OSHA has designed it.
Perfect. We have a few specific questions that I'll get to as we kind of switch into a few of the slides I'm going to present.
Great.
I guess last question for you for now, and again, audience, we're welcoming more questions. That form again is at the bottom of the landing page where you're viewing, or you can find the link in the description if you're watching on YouTube. But Brad, last question for now. Where can customers go to find either the documents related to the ETS or just more information from OSHA themselves?
Yeah, so the best place is just to go to OSHA's website, www.osha.gov, and when you go there, it's very easy to navigate, and I'm critical of OSHA sometimes, but their webpage actually is really good. There's a little banner there that says click here for the emergency temporary standard. It takes you to a landing page, and it's got a very easy format, links to a lot of compliance assistance. They put out FAQs, they put out model programs. They've really done a nice job in that front. So that's where I would recommend folks go.
Perfect, thanks. And we've had luck ourselves, and we've heard customers doing the same, reaching out to their local offices if they have particular questions. Pretty much everywhere you are, there's a 1-800 number you can call to speak to someone at OSHA, and we have found them to be very responsive, especially for questions related to this. Yep.
Good. No, absolutely. Yeah, absolutely.
Cool. Well, keep the questions coming in. We're going to switch to talking about some of what we've implemented for you in TELS already. And we're going to talk about some products that are related to this. So let me get the slides back up here. So TELS offers several best practice tasks for HVAC inspections already. So they're organized by category, things like air handlers, rooftop units. The tasks include detailed instructions and recommendations on what to inspect and at what frequency, and that's meant to align with ASHRAE's recommendations. But again, as we've both Brad and I have emphasized throughout, you need to go back to the manufacturer's recommendations. What we're able to provide to you is a template, and we match what ASHRAE recommends, but your manufacturer may specify a different schedule for different tasks. So you can think of these, some of these are inspection, some of these are replace this component at this frequency, things like that. Refer both to our best practices, but then confirm them with the manufacturer recommendations themselves. So you can find these in Task Self-Service. You can reach out to your TELS Power user to schedule tasks across your organization. Having these tasks in place will allow your facility to provide documentation for OSHA, which will show that you have a schedule and a plan in place and that you're meeting those expectations that you've documented. The plan you've set is the plan you're following. If asked for additional proof, facilities can pull the work history reports and show compliance with past inspections, cleanings, filter changes, things like that. So we've already put a lot in for these best practices. We're putting even more in literally as we speak. So over the coming week, you'll see more and more popping up based on both this OSHA ETS as well as on some of the standards that they specify and recommend within it. So beyond ventilation, we're also working on best practices tasks to help you get started with OSHA ETS more broadly, including things like the creation of the COVID-19 plan. So look for those, keep an eye out for those. We really want to support you and help you with staying compliant to all of this. So we're adding more and more. So from a filter point of view, and we actually had a question coming in about MERV 13 lead times. It has been hard to get a hold of MERV 13 filters. We recently added a new manufacturer to us, Purafil, and they have a great selection of MERV 13 filters as well as many other MERV ratings and different sizes. We've got all of the most common sizes and all the most typical depths. We do have MERV 13 in stock and ready to ship right now. So you can hop on our site and find the size that's going to be relevant for your system. If you're looking to go above and beyond, you can get options that are also antimicrobial or have odor control built in. So if you either have a specific need or there's a specific use case you're aiming for, we've got those available as well. Getting in a little bit into some air quality options. Like Brad mentioned earlier, OSHA says, these are the minimums, but you can go beyond them, and they do recommend going beyond them. Some of these are also recommended by the CDC and ASHRAE. We think with air quality, you very much need a multi-layer approach, especially when it comes to pathogen control, reducing exposure to pathogens, and thus the risk of becoming infected. You need to be adding all of these layers on top of each other to reduce the risk as much as possible. So the OSHA standard talks about things like maximizing the air changes per hour, getting as much outside air coming into the system as possible. You can see filters in this diagram, making sure that you're getting to the highest MERV rating that your system will allow for. We also have technologies like needlepoint bipolar ionization that will actively fight pathogens in your system without increasing the static pressure or increasing any wear and tear on your system. There's lots that we can discuss with you, and we're happy to help. We want your staff, your residents to be as safe as possible, and there's a lot of really good new technologies out there to help with this. One of the questions earlier was about portable air filters. There was actually a CDC study that came out just last week about how valuable these can be, especially in any areas with no or low ventilation. If you know that there's a room or a part of a room where you're just not getting good airflow, that means that you're not getting the air changes per hour that you need, means you're not getting air that's cycling through the filtration system as you would hope for. So adding a portable unit in that sort of a situation is invaluable. It's a big step up, and it's proven to reduce the risk of COVID infection as well as any other pathogens, and reduce particles and things like that. So we've, we all know it's been a rough year and a half for senior living. Thank goodness with vaccines, we're starting to see the other side of this. We've been honored to be by your side throughout all of this, and we are honored to continue to be able to support you in keeping your residents, staff safe, healthy, comfortable. So anything you need, any questions you have, you can visit directsupply.com or contact your dedicated account manager for help. We very much want to be part of this journey with you and make sure that you're getting everything you need to be successful. I'm going to look and see if any other questions came in before we wrap up here. Is there a printable compliance checklist available? We are putting this in TELS itself. There's also something provided by OSHA. So Brad was mentioning going to OSHA.gov earlier. You can find it there. Question about the availability of MERV 13. We have them available. Getting back to what we were saying before, I'm sure if you've placed an order and it's not yet come in, that that's not going to be an issue. I guess I shouldn't say I'm sure, but having that documentation that you've placed the order, I'm sure will be helpful if you have a conversation with that with anyone from OSHA. Do masks have a MERV rating? No, MERV is specifically related. It's the minimum efficiency reporting value. It's the size of micron that what percentage of a particle size will be filtered out by what level of MERV rating. Masks do have defined quantities. Like if you want to be an N95 mask, you have to meet a defined standard that you're letting a certain percentage of particles of a certain size through. So it's not the same standard, but there is a defined standard that they both have. What frequency should ductwork be cleaned? That's a great question. In that ASHRAE standard, it does get into some things about ductwork. I'd reference that. We also are happy to help with assessing whether or not your ductwork currently has an issue or needs to be cleaned, and then we can also help with that cleaning. Brad, question for you. Who will monitor or survey this? Is it HHS? Is it OSHA themselves?
Yeah, for purposes of this, it will be OSHA. It'll be an OSHA compliance officer. The other regulatory agencies that are going to be coming into your buildings won't be directly, enforcing this or focusing on this at all.
Perfect. more technical question, which I'll try to answer. Mini splits do not change air from outside. They don't bring outside air. What would be the best practice on that? So air changes per hour can be both how much outside air you're bringing in, but it's also how much air you're recirculating in your system itself. So you still want to maximize the air changes per hour. I believe, and Brad, correct me if I'm wrong, OSHA doesn't specify outside versus total air changes per hour, correct?
That's correct. It's exactly right. I mean, so yeah, either way, you're going to want to, whether it's recirculating inside air or bringing in outside air, you're going to want to maximize the extent to which your system can handle it.
Yeah, and the benefit there, as you're recirculating the air, it's still passing through the filtration again. If you've installed an additional technology like ionization, it's passing through that again. So there's still benefit to cycling the air and increasing ventilation. But I would say it is a even greater benefit if you can bring in outside air. OSHA, I don't believe, gets into this, but ASHRAE certainly does. You want to be mindful of what's going on outside too. If you're in a setting that has higher levels of pollution, unfortunately, we're getting into forest fire season out west. You do want to be mindful of what you're bringing in from the outside. You want to always be using whatever the best air available is. I guess I would put it that way. Let me see if we have any other questions. Will this webinar be available for sharing with our maintenance directors in the field? Yes, it should be available pretty much right after this. I would check back later this afternoon on the same page where you're watching it, and it should now be a recorded version as opposed to the live version that we have right now. And then does TELS Building Services offer consultation services for HVAC and ventilation concerns? Yes, we do. We can help with some of these checklists that the OSHA has already put out, ensuring that you are currently meeting the checklist as defined. We offer preventative maintenance programs that would line up with this, where someone's coming on site, they're doing the correct maintenance at the correct time and documenting all of that. So you have that ready. We are working on ventilation as well. How do you ensure that your system is where it should be? Same thing with filtration. How do you work with your system to determine what the best level of filtration would be? Again, many of these things are documented within the manufacturer guidelines. Depending on how designed your system is, though, you may need to consult that documentation. It might be a larger rooftop unit where the manufacturer guidelines say it could be from this range to this range, but it's going to have been designed for a specific application. And you're going to want to try to find that documentation and then ensure that you're lining up with that. Again, all of this is about getting back to where your system was designed to be. OSHA's not pushing you beyond that. They're not saying you have to reach some minimum setting. It's that your system is working as well as it was designed for. I don't think we have any other questions. Still a few more minutes if anyone wants to throw some in there. If you have any additional questions about how we're able to help, or you want to stay up to date on the services we offer, you can email us at indoorairquality@directsupply.com. We're happy to continue to be a resource here. We know we even had a few questions here that we are going to keep trying to get better answers on. It's I wouldn't say it's in flux necessarily, but there's certainly points that we want to be able to continue to clarify. Brad, any additional or closing comments from your end?
No, I just appreciate again Direct Supply putting this on and all the work that you all do for the industry and everyone's interest and don't sit on this. Get going. Good faith is what it is. Get going and try to get in compliance. If you have any questions, obviously reach out to Zane and Direct Supply and good luck for sure.
Well, Brad, I can't thank you enough. We know that this is a point of concern for a lot of our customers. We know you as building owners and operators are wanting to make sure that you're staying compliant, you're providing the safest and best care to your residents, you're keeping your staff happy and healthy. So Brad, thank you so much for your time and support and helping us navigate all of this. Great. And audience, thank you for all of the great questions today. And we will stay in touch.
All right. Thank you very much.
Thanks, Brad.